Greetings from Sri Shankara Cancer Foundation. September is the month dedicated to raise awareness about childhood cancers. Childhood cancers are rare but have one of the highest cure rates. It is important for us to create awareness about this and also stand in solidarity with the families and children fighting this battle. You may notice that we are wearing a golden ribbon. This is to signify Childhood Cancer Awareness Month, and we urge you all to wear a golden ribbon to work so that you can get people talking about it. To talk about childhood cancers, we have Dr. Anand K.C.
Hello.
Consultant Pediatric Oncologist, Sri Shankara Cancer Hospital and Research Center. So we commonly see cancers in older people or maybe people who are in their 40s or 50s. Do children also get cancers?
Unfortunately, the answer is yes. Cancer do happen in children, but out of all the diseases which happen in children like infections, pneumonia, malaria, dengue, gastroenteritis and other infections, pediatric cancers are very rare. Every year we see around 3 lakh children diagnosed with cancer all over the world, out of which 25% happens in developed countries like United States of America or UK, but rest 75% happens in developing countries like India, Pakistan, Bangladesh.
So what are the common types of cancers seen in children?
There are two categories of cancers which happen in children. First one is the pediatric hematolymphoid malignancies, these are the cancers which arises from the blood and lymphatic system of the child, which leukemias and lymphomas are the commoner ones. The second category is called pediatric solid tumors, which happens from the solid organs in the child like liver, kidneys or brain. So the common cancers are brain tumors, Wilms tumor, neuroblastoma and sarcomas.
What are the treatment options for childhood cancers, sir?
Yes. Childhood cancers are very sensitive to chemotherapy. So, most of the cancers in children are treated with a combination of chemotherapy, surgery and radiation. Also, there is a newer modality of treatment called immunotherapy, where we use child's own immunity to fight and kill cancer cells.
Okay. With all these types of treatment available, a common question I think most parents would ask is, what are the outcomes of these cancers?
Childhood cancers is considered one of the success stories in the history of modern oncology. In 1970s, less than 10% of the children diagnosed with cancers were cured. But in the modern times, more than 85% of them are effectively treated and cured. This drastic change in the outcome of cure rates of childhood cancers has come with major developments in the science and technology related to medical oncology. Due to the availability of better imaging and better diagnostic facilities, now we are able to diagnose the cancers at much earlier date. Also, we are able to diagnose most of the infections and their complications at an earlier date. With the earlier diagnosis of the cancer and its complications, there are newer and newer molecules and medicines available for the effective treatment. Now, the chemotherapies are effective; they are very effective in treating the cancer cells, and also with minimal or no side effects. Similarly, refinement in the technology of radiotherapy and surgical skills has made the cancer treatment more effective with minimal or less side effects. With all these changes in the medical science related to oncology, the cure rates has effectively changed from less than 10% to more than 80% in developed countries.
So you mentioned that there has been a change only in the developed countries. What is the scenario in India at the moment, sir?
Yes. Due to the lack of general awareness regarding the pediatric cancers among the healthcare personnel as well as the parents, many a times childhood cancers present often late and the diagnosis would be delayed. Of course, it would lead to advanced stages of diagnosis. Once they are referred to tertiary care cancer hospitals after the diagnosis of cancer, many centers don't have pediatric cancer units or pediatric oncology services for the treatment of childhood cancers, which would lead to further referral to metropolitan cities. So, due to delay in the diagnosis and limited availability of pediatric oncology services, parents are forced to reach hospitals which are far away from their places. Because of the lack of finances, because of the lack of facilities to stay nearby these centers for the prolonged treatment of pediatric cancers, because of lack of social support, many a times the parents abandon treatment in between or refused treatment in between. So the cure rates of children with cancer in India is less than 50%.
Okay, that is a sad number. How do you think we can tackle this, sir?
Sri Shankara Cancer Hospital and Research Center has established a dedicated pediatric oncology unit consisting of pediatric oncologists, pediatric surgeons, pediatric radiotherapists, nutritionists, counselors, and other support staff. Pediatric oncology ward at Shankara Cancer Hospital has a child-friendly pediatric wards with attached play area with the wards. We have facilities of chemotherapy, immunotherapy, radiotherapy, and pediatric surgery at our hospital. Often, childhood cancers treatment would be prolonged. Also, it requires a venous access for a long term in children for the delivery of chemotherapy and other services. So, we have a catheter care clinic for the administration of these central lines along with maintenance of these central lines. We have a patient support group to address the queries and concerns of the parents of children who are receiving cancer treatment at our hospital. Often, pediatric cancer treatment is prolonged. So, for the benefit of outstation patients, we have established a pediatric long stay center where these patients can stay and receive the treatment by coming to the hospital. Also, to address the long term effects of the pediatric oncology treatment, we have established a ACT clinic, which is after completion of treatment clinic at our hospital.
Sir, when a child is diagnosed with cancer, I think one question that a parent thinks about is what caused it, or could I have prevented it? Is there any known cause or known way to prevent childhood cancers, sir?
Cancers in children are much different than cancers in adults. Most of the cancers in adults are known to be associated with lifestyle disorders and aging process. For example, smoking leads to lung cancer. Chewing tobacco leads to oral cancers. Similarly, infections like hepatitis B and other infections would lead to liver cancer. But in children, 95% of the cancers are idiopathic, which means most of the pediatric cancers happen without any known reason during the normal development of children. Since there are no risk factors, most of the childhood cancers can't be prevented.
So, since there is no chance of prevention, how to diagnose pediatric cancers at an early stage?
Fortunately, cancers in children are rare. There are specific circumstances when the treating physician or a pediatrician should be considering cancer as one of the possibility in the children coming to the hospital. Any child with prolonged fever for more than a week, any child with unexplained bleeding, any child with unexplained weight loss or loss of appetite, any swelling in the neck, any bony or soft tissue swelling or abdominal mass, recurrent headache and vomiting in any child, white eye reflex in any child.
What is the final take home message that you'd like to give our viewers?
By increasing the awareness about pediatric cancers, many or most of these childhood cancers could be diagnosed early and treated appropriately, which would lead to improved cure rates among children with cancer.
Thank you so much for your time, sir.
Thank you.